Okay, so let's unpack this. Electronic health records, EHRs. We all know they're central, right?
Mhm.
Meant to improve things in healthcare. But what if they're actually causing real stress, burnout even for the clinicians using them every single day? It's what we're digging into today.
Exactly. And there's this fascinating research paper we looked at. It really gets into the unintended sort of negative side effects of EHRs on provider well-being.
Oh.
And it brings up this idea called the quadruple aim. It's a powerful way to think about how we could design and implement these systems better. Really makes you step back.
Okay, yeah, this is where it gets really interesting for me. The research shows EHRs often make work conditions worse. Can you paint a bit more of a picture? Like, what does that look like on the ground? What are these big frustrations?
Sure. Well, some studies show physicians spending almost half their time, nearly 50% just on EHR tasks and related admin work.
Half their time, not
Right.
on patients.
Not on direct patient care, no. And this massive time drain, plus the way consultations become so technology focused, it reduces actual patient contact. It can lead to this feeling of depersonalization, like providers are just serving the tech. It limits their autonomy, maybe even their clinical creativity.
So it's more than just the hours clocked on the system. It's the mental energy, too. I'm thinking like cognitive overload, the constant anxiety about the system. What was it called? Alert fatigue.
Yes, alert fatigue is a big one. Imagine constant alarms, notifications. Eventually, people just start tuning them out because it's overwhelming. It's like drowning in digital noise.
But with potentially serious consequences for patients. And what about this idea of human interoperability the paper mentioned?
Right. That's basically providers having to act as the bridge between systems that don't talk to each other, fragmented systems. So they end up entering the same patient information over and over again in different places. It's this huge, hidden, and incredibly inefficient workload.
Which sounds like it flies directly in the face of this quadruple aim you mentioned earlier. Now, most of us know the triple aim, right? Better patient experience, better population health, lower costs.
Exactly. The quadruple aim adds that critical fourth piece, improving the work life, the professional well-being of healthcare providers themselves.
So it's not just a nice to have.
Not at all. The paper argues it's essential. Provider burnout doesn't just affect the provider, it hits patient satisfaction, outcomes, even costs go up. So yeah, it reframes EHRs. They're not just a tech problem, they're a system problem, part of the whole healthcare ecosystem.
Okay, so if the quadruple aim helps us see the problem clearly, how do we use it to fix things? How do we actually align EHRs with it? What are the steps?
Well, the paper suggests three main areas. First, rethink IT funding. Focus it on, real-world clinical needs and making providers satisfied, not just checking administrative boxes. It means designing tech for specific practices, not just generic templates. And regulators. They need to look hard at documentation rules. Emphasize what's truly essential, not just pile on more features.
Makes sense. Less is more, maybe. And the second idea was co-construction. What's that about? Why is it so important providers are actually part of building these things?
Co-construction is key. It's about moving past blaming clinicians for resisting change. It's about building a shared vision, getting everyone, decision makers, managers, providers, maybe even patients involved in designing the solutions together. It can mean rethinking workflows, maybe bringing in new roles like scribes or clinical assistants to help with the data entry burden, and better training, expert-led training to bridge that gap between the technology and the clinical reality.
Right, building with them, not just for them. Okay. And the third piece, interoperability. Feels like we've been talking about that forever.
It's the persistent challenge, isn't it? The competitive market often works against systems sharing data easily. But true value comes when systems are compatible. The paper calls for certification criteria that are actually based on results, usability, adaptability in the real world. But a note of caution here, too. While better information flow is good, we need to be careful. Focus on sharing only the truly necessary data. Otherwise, you just risk drowning providers in even more information, increasing their workload again. It's about smart data flow, not just more data.
So this whole deep dive really highlights a critical need then. We need to fundamentally rethink our IT strategy in healthcare, putting that quadruple aim and provider well-being right at the center.
Absolutely. And connecting this to the bigger picture, the research even poses a pretty provocative idea that in some cases, de-implementing parts of EHRs might actually enhance care.
Yeah.
Which leaves you with a thought, doesn't it? What if real innovation in health tech isn't about adding more layers, more complexity? What if it's about elegant simplification, about technology seamlessly supporting care so providers can focus more on that essential human connection?